Hello, this is Harry Hobson, President and CEO of Plymouth Harbor, and I'm here again with my partner Karen Novak, who's the Administrator of Strategic Healthcare Initiatives here at Plymouth Harbor and really our point person on all infection control matters. We want to give you an update today. There are several areas we're going to talk about. Of course, we'll give you the COVID-19 update, then give you some information regarding our nurse call system, primarily focused just with our residents. I know today we had an AHCA, the Agency for Healthcare Administration, came through and did an unannounced infection control survey. And then I'll give you just a few words about the Window Project, where we are with that, and then an update on wellness program. So Karen, why don't we go ahead and get started and talk about the COVID-19, where we are today.
Sure. We have two positive cases that are in dining services, and then we have one positive CNA that was doing private duty in our assisted living. All three of those staff members have been quarantined and will stay quarantined for a full 14 days because two of the three are actually symptomatic. These, I think, are our first true cases that we're seeing of a positive COVID. One is asymptomatic. After that 14-day period, we'll bring them back in and start the retesting, and they will not come back on staff until we have those two negative testing. So we're going to keep our fingers crossed. I did speak to one of the staff members over the weekend, and Harry, I was sharing with you, this person was going a little bit, quote-unquote, room crazy, meaning he was wanting to get out of the house and do some things. And I said, this person, you can't leave your house. You know, this is why we're seeing that resurgence or more cases, because people get to feeling better, and then all of a sudden they think they're well and they want to go back out into the community. And little do they know, they're still shedding that virus, and that's how we see the numbers that we do in our community. So we spoke about a safe way to be outside in the backyard, contained, and away from his family a good deal. And I think he was happy about that. But it was a good resolution, but all the more, concerned to really say, don't go out if you are sick. Stay home and stay safe.
I think that's an interesting cycle, if you will, because if I recall, that individual's 14 days will be over either Wednesday or Thursday of this week.
Correct.
So let's assume that it's Wednesday, 14th day. Then is when we do the retest.
That is correct. We actually will not bring this person into the building. We'll do what we call a drive-through, meaning we'll have one of our nurses garb up with all the protective equipment and then go out to the car so this person doesn't come in, and we will swab them while they remain in their car, right, which is kind of nice. So we'll do that twice for that particular person, as well as the other two as well.
I called this person, I guess it was maybe a week or so ago, just to check in, see how they were doing. And what was shared with me was, I can't believe it, but my spouse has literally said, you are staying in this bedroom and not leaving. So there's they did it right.
They are still doing it right.
There, yes. Thanks to Karen, they're going to continue to do that. So we have the two staff members, one CNA. But from a resident perspective?
Absolutely no residents whatsoever, and that's wonderful news. But that doesn't mean, just like that person who was feeling great and wanted to go out, you please don those masks or wear your masks, and please remember to wash your hands, especially inside Plymouth Harbor. This is a time where we're seeing those numbers in horrific amount of numbers, ever so dominant here in the community. So please, make sure you have those masks on and keep that 6-foot distance.
Now, Karen, one thing I want to mention is I may have caused a little bit of confusion or misunderstanding last week. Last week, what we said was we were going to be, again, closing the campus down for visitors. And we went on to encourage our residents, please stay as close to your apartment as possible. This is a very, very critical time. All you have to do is turn on the TV or read the newspaper, and you'll see just how critical this is going into the 4th of July weekend. So, and we talked about that. Please do so. We gave a separate message to our team members, and I was just as emphatic with them that when they're not here, please try to stay as close to home as possible. Then on Friday, what we did was responded to a question regarding domestic travel.
Correct.
So that message on domestic travel was simply given to talk about the parameters of domestic travel. Domestic travel being okay, and we talked about not being okay to fly, to go on a riverboat, or to go on a cruise. It was not giving or encouraging people to do that. It was just responding to the questions we've gotten. So no, our position is please stay as close to your apartments as possible. Now, the other thing we did was to say we are going to continue to move forward with wellness, which we did last week, and I'll come back and talk about that here in just a moment. So I wanted to clarify that. We can't force people to stay here. We can strongly encourage, and that's what we were doing.
Absolutely, and if you have to travel for business or an emergency, I mean, that's going to happen. Internationally, it doesn't matter if it's business or an emergency, you will have to stay isolated. But domestic, within the United States itself, yes, there's no isolation period.
Got it. Okay, thank you. Comment about the nurse call system, very important.
Well, I want to
Oh, yeah, that's right. What are these papers?
This is unbelievably what we do each and every time for the Department of Health. As you can see, our Department of Health walked into their office this morning at 8 o'clock, and I promptly got a phone call saying, Karen, what is this? Well, every time we have an exposure or a possible exposure, we have to submit paperwork to the Department of Health, and then we have to report it on up if it's positive to ACA. So they were quite surprised to walk into their Monday. Their Monday is going to be like our weekend was, and quite busy getting this done. But it's just to really reassure you, this is not our top 10 things that we like to be doing, but it is important in the documentation, and this is how the tracings are actually put together, is based on the information that we provide to the Department of Health. And that tracer activity is so very important to identify people that have come in contact with that particular person. So this is our weekend fund.
Yeah, we see in the media and we hear the tracing, and we hear 2 or 3 minutes worth of describing it, but we thought maybe a picture was worth 1,000 words.
Yes.
And this is really what it's about. So you
where it
shipped all
begins.
that off, and then they are now analyzing it all the way through to figure out who may have been exposed.
Absolutely. So we may ask you questions at time, but it's important information that the Department of Health needs. So again, to do that tracer activity.
Okay. Nurse call system.
Tomorrow morning, I believe from 10 a.m. to 12 p.m., the nurse call system will not be active for the independent residents. That means if you push your pendant, it is not going to work. So please remember to dial 555 should you have any kind of emergency. We have extra nurses on staff in home care. If you need some help, we'll come running to assist you in any way that we possibly can. But the only way, again, that you're going to be able to get some help is to dial 555. And if you don't have that little adhesive label on your phone, please call Home Care today. We'll make sure we get you that label so you can put it on your phone, because sometimes in that emergent situation, Harry, you can't remember your own name, let alone 555. Right. But if it's right there on your phone, chances are you're going to remember it.
And what I want to clarify is, as you can see at the bottom of your screen, today is Monday, June 29th. So when we talk about tomorrow, we're talking about June 30th on Tuesday. The reason I'm emphasizing this is because this video will run through most of the day on July 1st. So June 30th, tomorrow, that's the day.
Correct.
Okay.
From 10 a.m. till 12 noon.
Okay. And some good news again. We're rarely ever called ahead of time to say we're coming. So why don't you clarify that?
ACA, our Agency for Healthcare Administration, has the notorious way of showing up unannounced, and they did that just this morning, which was really good because we had all of our ducks in a row. And they came and they did an inspection on our infection control. Once again, they were very, very pleased with our process. Luckily, it was the same surveyor that came last time, but she was very glad to see all the efforts that were being done, all the testing that we're doing. We are complying with the Department of Health. We are complying with our reporting to the state level, ACA, and the national level, the NHSN, the National Hospital Safety Network. So they were very pleased with everything that they saw, and they gave us flying marks that we did a great job. So good job for the team.
That's what I was going to say. You had mentioned to me earlier that you were pleased working with Katie Tackett. Katie is our new director of nursing and a good team member.
Katie is she's had a real introduction to Plymouth Harbor. She's had multiple visits by ACA, and then she came in during the COVID. So what better way to get thrown right there into it? But she's doing a great job.
And our Vice President of Health Services, of course, Joe DeVore, being very key
Absolutely.
To this as well. I do have to share something kind of amusing, and that is that Joe was on his way, let's just say let's just say a crown at the dentist this morning. So he was going to be unable to be here. Once he received the phone call, he got out of the chair and he made it in here, and everything went very fine. And I read an email from Joe a few minutes ago, and he said, I think the crown would have been less painful than sitting through the survey again with the anxiety.
Well, ACA is never a fun thing to have to go through, but you know, when it comes to infection control, as I said to the surveyor, bring it on, let's go.
We got this. Good. Thanks, Karen, very, very much.
Sure.
Then just a couple other updates quickly. I was down in Pilgrim Hall earlier this afternoon. George McGonigal was meeting with the residents of East Garden, and he let them know that beginning next week, the first week in July, we're going to be staging for the hurricane window installation for the East Garden apartments, and the actual installation will begin then 1 week later on July 14th. One other note of interest, and that's Summer Wrench, our director of our wellness program, spoke with her earlier today, and she was very pleased in the phase 2, which kicked in today. Just about 1 o'clock today, she'd had 48 residents that had come through. She was very pleased. She reported the residents were also pleased to be here and participating in the program again. And so we worked out a few bugs last week in the new electronic scheduling. All of that, she said, went beautiful today. Now, what I do want to say is phase 3 is, we said, is tentatively to become effective on July 13th. And that gets more involved in the group activities. And right now we're really taking a strong look at July 13th, knowing what's going on all around us, knowing we're going into the 4th of July weekend. So don't be surprised with our next update that we don't come back and move that. We may move that until August 4th. Okay, we've got to be at a certain comfort level, and we're not quite there yet. So, but we'll confirm that by the end of this week. So, and I believe that's all I've got today.
Okay, well then we'll get ready to end our show by saying, please remember to wash your hands. Utilize that antibacterial soap quite often. Hit those high contact areas, especially your keys and your cell phone. Please remember social distancing. That is so, so important. And even over the weekend, the CDC has now come up and said your masks have two-way protection, not only to prevent the actual spread of that germ, but to prevent you from getting it. So it's going like a buy one, get one free benefit. So
That's true.
Please remember to wear your mask when you're outside.
Karen, this video is over, and that means it's time for us to wear our mask.